I made a video about pterygium or surface eye, and I noticed that some of my viewers were interested in that particular topic, which has made them to request for my suggestion on pterygium excision, and that is what I have come to address officially, especially for other people who might be having pterygium or surface eye in their eyes. Hi everyone, welcome to Seeing is Living, where you find vital information about your vision, sales of vision products like frames, sunglasses, protective lenses like blue cut, photochromic lenses, as well as contact lens. If you're just watching me for the first time and you're yet to subscribe to my YouTube channel, kindly do so, as this encourages me to produce more educative videos like this. Having said that, let's go straight to the topic. Those of you who usually follow instructions, especially for unprofessionals or salespeople online, telling you that there are eye gel or eye drop or eye lotion you can use to wash your eyes, or gel that you can use to rub under your eyes on your eye that will dissolve pterygium. I am here to tell you that it is a very fat lie. There is nothing, there is no eye drop, no gel, no solution that can dissolve pterygium. If that was possible, I don't think we'll be having numerous number of patients or people walking around with surface eye or pterygium. Even those whose pterygium is so progressive that it has encroached to the black part of the eyes. That is the first thing I need to remind you guys. So do not be deceived, especially online. If you need any medical advice, it is better to get that from a hospital or your doctor, especially the one you trust. So back to pterygium excision. So I had like 3 persons asking me what is my suggestion on pterygium excision. Pterygium excision is the only way pterygium can be removed from your eyes. Like I said earlier, no eye drop has been found to dissolve pterygium, just like they usually tell you online, and you'll be saying you want to buy. That is not even what I want to do. Today, I don't even have strength for that one. The day I will have strength, I will address that. The only thing eye drops, and these are certain type of eye drop, I'm not going to be mentioning that so that you people will not run to chemist shop to go and buy. What we usually do or prescribe in the hospital in regards to pterygium when it comes to eye drop is some eye drop to manage the symptoms associated with pterygium, which include redness, itchiness, and tearing. So the eye drop your doctor usually prescribe for you with respect to pterygium does not mean that that eye drop is going to dissolve or remove the eye drop from your eyes. The eye drop is just to calm the symptoms. So if you want to permanently remove pterygium from your eyes, the only option you have is to go for pterygium excision. But the problem with pterygium excision, and the reason why most doctors don't advise their patients to go for pterygium excision, is because of its high rate of reoccurrence. What I mean by reoccurrence is that after going for pterygium excision, there is more than 50% that pterygium will come back, and this time around when it's coming back, it comes with a full force, and it can encroach to the black part of your eyes or trying to cover your pupil, and that is not good. So it means that you have wasted your money, your time. Even the doctor has wasted his or her time doing this pterygium excision, because no doctor will be happy to have operated a patient for a particular illness or a particular thing, and then few months later you see this particular thing coming back again. No doctor will be happy to see that, as well as the patient. That is why we rarely carry out pterygium excision on patients unless in a tight situation. That is, if the pterygium has encroached already to the black part of the eye, or even trying to cover the pupil, then the doctor will not have any other option than to remove this pterygium. And we can only hope that the pterygium does not reoccur. There are basically 3 major types of pterygium excision. There is one they call bare sclera techniques. These techniques involve removing the pterygium from, that's the white part of the eyes, and after removing it, it will be left bare or open like that. This type of pterygium excision usually has higher rate of reoccurrence. They also have another mechanism known as conjunctival autografting. This type has lower rate of reoccurrence. It's the same with the first one, that is bare sclera method. The difference is that after the pterygium is removed, it is being replaced with a harvested conjunctiva in order to cover up that particular spot where the pterygium was removed. This helps to reduce higher rate of reoccurrence, at least from 2% at lowest to 40% at its highest. And they have another one that they use amniotic membrane to replace. The difference is that instead of using a harvested conjunctiva to cover up the space where the pterygium was removed, they use amniotic membrane, and this one also has lower rate of reoccurrence. So my advice is that before you go for pterygium excision, you need to sit down with your doctor and find out, if possible, the method he or she will use to remove this pterygium from your eyes, if it is the conjunctiva autografting method or the method that involves using the amniotic membrane, or if they are using the best sclera method, because the best sclera method is usually complicated because it has higher rate of pterygium reoccurrence after pterygium excision. I think discussing the techniques that your doctor might want to use is very paramount when going for pterygium excision, so as to know what to expect after pterygium excision.